Good afternoon. I am Dr. Alissa Rexo. I'm a veterinarian specializing in dermatology in Virginia. Today, I would like to discuss the effect of topical medication on the nasomaxillary skin fold microbiome of French Bulldogs. Host microbe interactions influence dermatitis pathogenesis in nasomaxillary folds of brachycephalic dogs. This interaction may be complicated by secondary bacterial and fungal infections. Multi-drug resistant infections have resulted in antibiotic selection that is quite limited. This study had two objectives. The first objective was to investigate the effect of two topical products, including a 2% chlorhexidine solution, which is a known broad-spectrum biocide, and a protease-based product, an enzyme solution without biocidal activity on the microbiome. The second objective was to evaluate the abundance of clinically relevant pathogens and the microbial diversity inhabiting nasomaxillary skin folds of systemically healthy French Bulldogs. The microbiome is defined as the combined genetic material of the microorganisms in a particular environment or part of the body. These microbes include bacteria, bacteriophage, fungi, protozoa, and viruses. They may live inside and on the body. In humans, it is estimated that there are 10 times as many microbial cells compared to human cells. Previous canine microbiome studies have looked at bacteria. However, this study also included fungi. Bacterial adhesion to surfaces is the first step in colonization, invasion, and biofilm formation. Biofilm is the predominant mechanism of skin microbiota overgrowth and promotes adhesion and persistence in the cutaneous microenvironment. Kelzyme is an enzyme-based formulation. It is commercially available in use for treatment of a wide range of common skin disorders in dogs, including bacterial pyoderma. Proteases are an established, well-tolerated class of therapeutic agents. The protease-based product forms a temporary barrier against microorganisms when applied to the skin. This barrier strengthens the protection against infection and prevents the ability of bacteria and fungi to bind to the cells of the skin and mucous membranes. The protease-based formulation provides gentle cleansing, moisturization, and contributes to a decrease of inflammatory pathways common to many dermatoses. Two products were evaluated: a 2% chlorhexidine diacetate solution, otherwise known as Novolsan, and an enzyme-based formulation containing protease, glycerin, hyaluronate, calcium chloride, water, buffer, and bittering agent, known as Kelzyme. The control group was left untreated. This was a randomized, single-blinded prospective study performed on 19 systemically healthy French Bulldogs. We had 6 control, 7 enzyme, and 6 chlorhexidine subjects. The French Bulldog breed was selected due to their prominent nasomaxillary folds that predispose the breed to intertrigo. The image in this slide is from an actual study participant. Exclusion criteria excluded any subjects with deep pyoderma in the nasal folds, and any application of other topical products or systemic antibiotics and glucocorticoids 2 weeks prior to and during the study. None of the enrolled subjects had overt clinical signs consistent with atopic dermatitis as defined by Favreau's criteria. The median intertrigo score, which was the sum of the clinical and the cytological scores at inclusion, was 5, with a maximum score of 48. For all enrolled subjects. The dogs were treated twice daily for 28 days. Bacteria and fungi were profiled by NGS Methodology using a swab collection kit provided by MyDog. Next-generation sequencing is a DNA sequencing technology used to assess the skin microbiota in its functional capacity. Skin microbiome and cytological samples were collected from swabbing bilateral nasomaxillary folds on days 0, 14, 28, and 42. Day 42 was 14 days after treatment was discontinued. The results from the nasomaxillary skin fold microbiome in all 19 dogs at inclusion revealed a low diversity at both bacterial and fungal phylum level. This was prior to any topical treatment. However, there was a high bacterial diversity and low fungal diversity at the genus and species level. The most abundant bacteria observed at inclusion were Staphylococcus, Streptococcus, and Corynebacterium. The most abundant fungal genera observed were Cladosporium, kingdom fungi, and 2 taxa assigned to the phyla Ascomycota and Neoscoceta. The average abundance of genus Malassezia was 3.7%. The study showed that topical treatment increased the diversity of bacterial and fungal compositions over time. The diversity increased by 38% for the enzyme treatment group, 11% for the chlorhexidine group, and by less than 5% for the control group. The relative number of pathogens in the various cohorts differed at the day of inclusion, with 35% of pathogens in the control group, 54% in the enzyme group, and 23% in the chlorhexidine group. There was a clear correlation that was observed between the abundance of clinically relevant pathogens and microbial diversity. This finding indicates that a low abundance of clinically relevant pathogens is correlated with a high microbial diversity score, and we measured this utilizing the Shannon Index. In both treatment groups, the abundance of clinically relevant pathogens decreased significantly compared to the control. There was no statistical difference between the chlorhexidine and the enzyme groups. This table shows the most abundant bacterial and fungal genera found in the nasomaxillary folds of French Bulldogs. Clinically relevant pathogens were identified by a literature review, which yielded 29 clinically relevant bacterial pathogens and 6 fungal pathogens. Staphylococcus delphini intermedius pseudintermedius from the phyla Firmicutes were the most abundant bacteria at day 0 and could be detected in 79% of the subjects. A statistical analysis was conducted and identified 30 species that were significantly impacted and enriched by the treatments. The control group had the least amount of changes over time compared to the 2 treatments. Treatment effects were very individualized for both the patient and the taxa. In most cases, changes occurred immediately and then stabilized or returned to the start value. The main skin bacterial phyla inhabiting the skin folds of the dogs were Firmicutes, Actinobacteria, and Proteobacteria. The main skin fungal phyla were Ascomycota and Basidiomycota. The nasomaxillary skin folds microbiome of systemically healthy French Bulldogs were shown to contain a high abundance of clinically relevant pathogens. And these findings suggest that antimicrobial therapy may restore diversity of the skin fold microbiome and reduce the abundance of clinically relevant pathogens. Topical therapy with enzyme increases microbial diversity in the skin folds and reduces the relative abundance of pathogens. And this study finding supports other previously published results. Additional studies on dogs with clinically evident nasomaxillary fold pyoderma are needed to confirm these findings. However, this study further expands our knowledge and understanding of the microbiome, especially since French Bulldogs are a breed treated frequently by veterinary dermatologists. And lastly, I want to mention that this is my personal Frenchie Pickles that I rescued last spring after I finished collecting my data and I fell in love with the breed. I'd like to thank my co-authors on this manuscript, Bruce Hansen, Mats Clarson, Janina Krumbeck, and Joe Bernstein, for their support and mentorship during this study. I'd also like to give a special thank you to Valerie Fadok for her support with the study design and manuscript. And I would like to thank my dog for providing the swab collection devices and performing the microbiome analysis. And lastly, I'd like to thank the dermatology clinic staff, especially Jolie Sullivan, for her support during the study.